So if you've just recently had surgery, let's prevent issues with those incisions. Keep them dry, avoid friction. You may need a seamless tank in between you and your compression garment to help prevent that rubbing feeling. And if you've had a cough or a sneeze, you know what hell on earth that can be, so brace for impact. And tell anyone with a cold to just stay away. Give you a phone call instead. Keep those bowels going. Now is not a time to get constipated. And your incisions, don't pick at them. Just leave them alone. Leave the tape on until the doc tells you it's time to take them off. Stitch issues can be a common problem. They're not the end of the world in most cases. If you don't have signs and symptoms of infection like redness, pain, swelling, drainage, or the incision opening up, it's probably just an issue with the stitch and your body doesn't like it. So it can be pretty simple. You just use a pad to soak up any leakage. If you see stitches spitting out, talk to your surgeon and they may advise you to take it out. It's really not as bad as it sounds. It's usually just like a little bitty knot and it's pretty easy to do. So just keep it covered. Don't slather on ointments and creams and stuff unless you have like an itty bitty tiny opening and you want to put a little bit on that one little tiny spot and cover it with a bandage. Otherwise, chances are you're going to create more of a problem, so you're better off leaving it alone. If we're talking about a full incision opening up, my best advice is to get to a wound care center. Tightness is going to be a common feeling. You've got a lot of swelling. You've got potentially multiple procedures happening at one time, so you've got lots of insult to your body. Make sure that you keep moving. We want you walking around the house, doing a little bit, but don't overdo it. If you overdo it, you're going to increase swelling. You're going to potentially create more problems with your incision or cause more tension. And, you know, tension can open things up. So be careful. Manual lymphatic drainage, we're talking very gentle type massage. I'm not talking about the stuff where you're having fluid drained from your body. That's incisional drainage. That may or may not be required, especially if you're past the first week of surgery. So manual lymphatic drainage, not opening it up, just gentle. It should be gentle. You want to make sure that you're eating food you can digest easily, because if it's hard to digest, you're going to increase that feeling of tightness. So lower sodium, lots of water, things that break down easily for your body. Just give yourself a chance to recover. So short bouts of movement. You don't want to be like running around like crazy all day. Take it easy. Get your feet up. Wear your compression. It's going to help. We're always worried, of course, that our incision is going to fail. So the first thing you should do, if you have an experience where part of your incision line opens up, is call your surgeon. Typically, I have found surgeons may or may not be the best wound care people, so you can always give your local wound clinic a call and try to get on their schedule, see how it works with your insurance. Just get some information, because sometimes they have a long wait time, especially if your surgeon is not local. So you can potentially go to your primary care provider. You can go to urgent care or something like that. Antibiotics, if you've got a big open hole in your body, it's super susceptible to infection. Things can change very drastically. So getting on antibiotics is a good idea, even if it's not as bad as you think. At least getting the ball rolling, because things change. And definitely keep it covered. This should not be open to air. The air is not going to heal an open incision. Once we have an open area, now we're treating it like an open wound, which is going to be much different than keeping it dry. Now, if you've listened to me at all, you know that if you're getting advice to use wet to dry or dial soap or vinegar or anything like that in your wound, that's when we should book a chat maybe, or especially if you don't have a local wound person in your area, I can at least give you a bridge in between this happening and getting you some good local care. So reach out if you need help.